Hello, everybody. I am Dr. B. Archana, a practicing homeopath from Chennai, Tamil Nadu, India. I have my own clinic, Dynamic Homeocure, in Arambakam, Chennai, Tamil Nadu. Since 2014, I run my own Tamil YouTube channel, Dynamic Homeocure, to dispense the knowledge given by Dr. Hamer. I am associated with Global GHK Foundation since 2017. Our website www.globalgnm.com has rich learning material for those who seek GHK sincerely. We conduct weekly paid webinars. Interested people may explore our website and get yourself enrolled for them. Let me share my screen. So the topic for the day I have chosen is cell injury and cell adaptation in the light of GHK. So first we will be seeing what is cell injury and what is cell adaptation from conventional medicine point of view, and we will correlate it with the understanding of Germanic healing knowledge. So myself, Dr. B. Archana. Disclaimer. The information given in this presentation is for educational purpose only. It is not intended to be a substitute for professional medical service. Participants shall consult their medical doctors for health reasons before using anything that is disclosed during the course of this presentation. Students shall not use any of the different information given in this presentation while writing their examinations. So tributes to Dr. Samuel Hahnemann, the founder of homeopathy, to Dr. Ryke Geerd Hamer, the founder of GHK or GNM. GNM is German New Medicine. Today we are celebrating his 90th birth anniversary, and this presentation is dedicated to Dr. Hamer. Gratitudes to my guru, Dr. Praful Vijaykar sir, and my GHK mentor, Dr. CJ Varghese sir. So before beginning my topic, we will see what is a cell. So we all know that cell is a basic unit of life. Cells forms tissues and tissues form organs and organs form the system like respiratory system, digestive system, and your cardiovascular system, skeletal-muscular system. So cell is a basic unit of life and it forms tissues, tissues form organs, organs form organ systems, and all the organs together constitute the human body. Most forms of diseases begin with cell injury, followed by consequent loss of cellular function, says our conventional system of medicine. So what is homeostasis? I don't know how many of you know about this term. So it is nothing but the inbuilt mechanism to deal with changes in the environment outside the cell. Though the cells of our body have an inbuilt mechanism to deal with the changes in the environment. Environment means extracellular fluid. That is the space between two cells. Okay. So this is called as homeostasis. So cells must constantly adapt to changes in their environment, even under normal conditions. These physiological adaptations usually represent response of cell to normal stimulation by hormones or endogenous chemical substances. So cells constantly adapt to the environment, even under normal conditions to carry out the day-to-day activities like digestion, respiration, cardiac functions, everything, and even the muscular movements, everything. So to carry out normal functioning and day-to-day work, the cell is constantly adapting itself. So cells actively control the composition of their immediate environment and intracellular milieu within a normal range of physiological parameters. So we cannot have a concrete number or a concrete value when the cell is constantly adapting according to the need of the body. So we have only ranges. So we say, no, like your blood sugar, fasting blood sugar should be between 80 and 120. What to say, your thyroid value should be between 0.5 to 5.5. So we give only range because the cell is constantly adapting itself according to the day-to-day requirement or according to the need of the body, even in a normal condition. So we must understand that cells adapt every now and then, and it is happening to maintain the homeostasis. So cell adaptation is a natural phenomena of the cell to maintain the daily routine and in turn run the life. Also, we must understand that cells control the immediate environment and the extracellular fluid within a narrow range so that the adaptation happening on daily basis is not exceeding certain limit. We call this range or limit as the physiological normal range. This adaptation to maintain within this normal range is called as homeostasis. The term homeostasis is coined by W.B. Cannon. So it is also called as internal environment or internal milieu. Milieu interior is a term coined by Claude Bernard. So this means maintenance of constant internal environment. So physiology textbooks say homeostasis is essential to maintain the normal physiological activities in the body. So whenever there is a threat to alter the physiological activities, various systems of the body try to regulate and adjust the functions in such a way that the condition is brought back to normal. So you have to keep this homeostasis point in your mind. Then you will understand how the cell is adapting, why the cell is adapting, what will be the impact of the cell injury. So how it will be responding to the injury and all. So homeostasis is the inbuilt capacity of the cell to maintain the normal, to maintain the day-to-day activities within the normal range. So now what is cell adaptation? So cell adaptation is the ability of the cells to respond by increasing functional demand to various types of stimuli and adverse environmental changes. These are reversible changes in the number, phenotype, that is a physical structure, metabolic activity, or functions of cell in response to changes in their environment. This is the definition given by the conventional system of medicine. We can use it for our understanding about the cell adaptation. So cellular adaptation allows cell to survive and continue to adequately function. So the purpose of the adaptation is survival of the whole organism and to carry out the day-to-day activities. So the adaptation is happening only for running the show. So cellular adaptation is a state that lies intermediate between the normal unstressed cell and injured overstressed cell. So cellular adaptation is the ability of the cell to respond to stimuli or adverse environment by producing reversible changes. The reversible changes could be change in the structure or change in the number or alteration in the metabolism or functioning. So cellular adaptation may be classified into two according to the need. So it could be physiological or it could be pathological. So cell adaptation is taking place every now and then. I told you already, right? So it is happening every now and then to maintain the normal functioning of the body. So when the stomach is empty, the cell adapts accordingly. When the stomach is full, it is working to digest. So when the lung is expanding, it is working. When the lung is contracting, it is working. When the heart is contracting, it is working. When the heart is relaxing, it is working. So cell is constantly adapting itself to run the normal physiological function. So this ability of the cell to respond and adjust can be physiological or pathological, meaning it can be happening for normal functioning or as a disease manifestation. So this also you need to remember. So when it is called as physiological, when it is called as pathological. But the mechanism underlying is the same. So pathological adaptation is happening to escape the injury and to survive in the toxic or hostile environment. This is also given in the conventional system of medicine books. So the pathological adaptation is happening to escape the injury. But the underlying mechanism is the same. So today we will be learning the mechanism briefly. So normal unstressed cell adapts constantly for surviving and to carry out daily activities of the organism. This adaptation is reversible. And this maintaining of the normal range is called as homeostasis. We already saw, no? So this maintenance of this normal range is called as homeostasis. So repeated stimuli or repeated injury makes it tougher for the cell to reverse itself to normal physiological range. In that case, the cells undergo adaptation to achieve a new steady state that would be compatible with their viability, within their viability in the new environment. So when the environment is hostile, the cell adaptation is taking place so that a new steady state is attained within their viability to accommodate the new hostile environment. But if the cell injury is too severe, the affected cells die. And this death is called as irreversible cell injury. So adaptation is happening every now and then. The new steady state achieved by the cell to handle or cope up with the injury is still named as reversible cell injury, as a cell continues to function with some ups and downs, but it runs the show. Day-to-day activity and the life is, life is moving. So death is not happening. But when the injury is too severe, the cell loses its adaptability completely and dies. And death of the cell is the irreversible injury according to the modern medicine. Hope things are clear till now. So in cell adaptation, we have three components. One is the cell injury. Second is a cell that is involved, affected, or the target cell. Third is the response to the injury by the cell. That is the adaptation. The adaptation could be hyperplasia, hypertrophy, atrophy, metaplasia, and dysplasia. We will be seeing one by one in detail. So first is cell injury. So what is cell injury? Cell injury is best defined as the cellular changes caused by stress which exceeds the cell's adaptive capability. So when when the stress is exceeding the adaptive capability of the cell, it is called a cell injury. So when the adaptation is constantly happening, no. So when that capability is exceeded by the level of stress, the cell is injured. The cells may be broadly injured by two major ways. One is by the genetic cause and second is by the acquired causes. So if I have to say this stress adaptive capability, I can give you an example. If you are taking a night shift job or you are moving to US, your body adapt to the new time mode or new time zone, no? But this is not an injury. If in a night shift, you get an annoying boss, or in the US, you face some difficulties in getting a place or in processing your job visa or something like that, means it will cause an injury. So adaptation is not always a disease thing. So adaptation is happening daily. Adaptation is happening even to run the normal functioning of the cell. Only when the adaptive capability of the cell is failing or it is permanently changed, we call it as the cell injury. So cell injury can be caused by genetic cause as well as it could be caused by the acquired cause. So today we will try to understand the congenital and acquired causes from the GHK perspective. So this you see in this slide, no? So this area we will be studying. So adaptation is constantly happening, but the adaptation which is exceeding the daily routine need could be reversible or it could be irreversible, and it is happening because of the injury. So the point of no return, this is a point of no return where irreversible changes will be happening and the cell will not come back to the normal state. So this is a definition from the conventional medicine point of view. So in cell injury, we have acquired causes. We'll be seeing the congenital causes later. First, we will take this acquired causes from conventional medicine point of view. The acquired causes of disease comprise vast majority of common diseases afflicting mankind, says conventional medicine. Based on the underlying agent, the acquired cause of cell injury can be further categorized as under hypoxic injury, that is oxygen deficiency, free radical injury, aging process, microbial agents and infections, immunological causes, physical agents like trauma, heat, extremes of cold. So chemical agents, including the drugs we use and the chemicals and other things, nutritional defects, psychological diseases, mental causes, iatrogenic factors, that is drug induced, and finally idiopathic diseases. So these are all the acquired causes from conventional medicine point of view. So as we already saw, the cell adapt every now and then. The type, duration, and severity of the injury defines whether the cell can cope with it or will undergo reversible adaptations or will undergo irreversible adaptation or even die. So types of cell injury. So it could be reversible or irreversible. Reversible cell injury. In early stages or mild forms of injury, the functional or morphological changes are reversible. If the damaging stimulus is removed at this stage, although there may be significant structural and functional abnormalities, the injury has typically not progressed to severe membrane damage and nuclear dissociation. So, what do you understand from this? So, when the injury is in a milder form, even the functional changes or the morphological changes will come back to normalcy. It is reversible. So earliest changes associated with cell injury, that is biochemical or intracellular level changes we see in reversible cell injury or decreased generation of ATP, loss of cell membrane integrity, defects in protein synthesis, cytoskeletal damage, DNA damage. So how do we differentiate this from irreversible injury? So irreversible injury is marked by severe mitochondrial vacuolization. So mitochondria is the energy storage system or the powerhouse of the cell from where we get this ATP. ATP for energy generation and to carry out our day-to-day routine. So when there is a severe irreversible injury in the cell, the mitochondria, that is the energy producing organelle in the cell, is severely damaged and it is seen as vacuolization inside the cell. So extensive damage to plasma membrane. So the plasma membrane is also damaged severely if the irreversible cell injury is happening. And there is a swelling of the lysosomes. Lysosomes are the, they phagocyte or they eat the toxins produced during the activities carried out inside the cell, and these lysosomes swell in case of irreversible cell injury. And there appears large amorphous densities in the mitochondria. So these are all the cellular level changes happening during irreversible cell injury. So finally, as we already saw, when the injury becomes irreversible, at that time the cell cannot recover. Thus, it dies. So, mechanism of cell injury. Mechanism of cell injury means what is happening inside the cell. So that is what is called as mechanism. No, so irrespective of the type of cell injury, common underlying mechanism involves mitochondrial damage and cell membrane damage. So one is the mitochondrial, that is a energy producing powerhouse of the cell, no, that is getting damaged. And second is the cell membrane damage. So this is reversible, and the cell membrane damage is irreversible. So whether it is a mitochondrial damage or it is a cell membrane damage, the underlying mechanism is the same. So most of the time in conventional medicine textbook, if we see, means this major cause of cell injury is attributed to hypoxic or ischemic cell injury. So this is the beginning point of cell injury, they say. So in case of reversible cell injury occurs due to decreased cellular ATP, causing initially impaired aerobic respiration, followed by anaerobic glycolytic oxidation. Other changes are intracellular lactic acidosis, damage to membrane pumps, sodium, potassium, and calcium pumps are damaged, and dispersal of ribosomes happens. So, in case of irreversible cell injury is due to continuation of the earlier changes, and it includes further calcium influx. We saw, no? So calcium, sodium, potassium channels and pumps are all damaged. So this allows more calcium to get into the mitochondria, and further damage to the membrane happens, and cytoskeletal and nuclear membrane damage also happens. So lysosomal damage causes release of hydrolytic enzymes, ischemic reperfusion injury. So when there is a cutoff of blood supply, or when there is a reduction in the blood supply, means there will not be any oxygen supply. This is called as hypoxic injury. And after a brief period of ischemia or the stoppage of blood or hypoxia, if again blood is coming into the vessel and reperfusion is taking place, means this can also potentially damage the cell injury. This can also potentially cause the cell injury. So this can also injure the cell. So this is called as ischemia reperfusion injury. So another one is the free radical injury. Free radicals are the components which have free oxygen ion in their outer electronic orbit. So which are always waiting to combine with something, and this produces a severe damage. So we'll see that in detail later. So free radical injury occurs when their generation exceeds their elimination and is implicated in mechanism of cell injury from various etiologies. So stress proteins. So mechanism of cell injury happens in three ways. So one is the mitochondrial damage causing depletion of ATP. ATP is the energy storage in our body. So second is the cell membrane damage disturbing the metabolic and transmembrane exchanges. That is the exchange happening. The ion exchange happening between the between one cell to another, and from inside of the cell to the outside of the cell. This is disturbed by the cell membrane damage. And third is through the release of toxic free radicals. So the mechanism that is happening in the mitochondrial damage as well as in the cell membrane damage is a complex thing. So I have not gone deep into that. So though I have prepared a very vast notes, and I prepared and included few slides for that, I did not include them in this presentation because I don't want to complicate things, because instead of going deeper and deeper into the cellular level, we have something much more important for us to learn. So I will show only the pictorial representations and move ahead. People who are interested to know about the process happening inside the cell when the cell is damaged can very well go and read it from the Google or from source books. But this is not the topic, or this is not the thing I wanted to convey today. So I will show it very briefly. So we say that Germanic healing knowledge is for everybody. It's for layman. It is for non-medicos also. When we say that it is for non-medicos also, it should not be very complex, and it should not be too much into medical terminologies and too much into the physiology and complicating things. So once I go deeper and deeper into such things, you will lose interest to learn Germanic healing knowledge. So I will skip the process for time being. People who are truly interested and medicos who are listening to this can very well go and explore in detail about the mitochondrial damage and what is happening, what ions are coming inside, what ions are going inside, how the accumulation of calcium ions are causing the damage. Everything is given in detail about this cell injury in our internet as well as in your source books. So let me skip it for time being and for today's presentation. So mitochondrial damage causes a depletion of ATP, and the depletion of ATP will in turn lead to all these things. I briefly told about this anaerobic glycolysis, and anaerobic glycolysis leads to increased accumulation of lactic acid. So lactic acid accumulation will lead to further damage. So sodium pump fails and there is influx of potassium ions into the cell, and there is a high concentration or influx of calcium happening into the cell. So these are all complex mechanisms. So you may read it from the pathology books. So effect of depletion of ATP. So mitochondrial damage is happening, and this mitochondrial damage affects the ATP generation. So the effect of depletion of ATP will lead to all these things. So second is a cell membrane damage. Cell membrane damage means it is a irreversible cell injury, we saw, no? So the membrane of the cell itself is damaged, and it is a severe problem also. So third is the release of toxic free radicals. So toxic free radicals, when I was exploring about this free radicals, sources of free radicals and how it is affecting the cell and all, I came to know about two interesting factors. That is, during the process of inflammation as well as during the normal metabolism, these free radicals are released. So free radicals are produced even during the normal metabolic activity, and even during simple inflammatory conditions. So this you have to keep in mind, because free radicals are not only coming from ultraviolet radiations, air pollution, or from ionizing radiations. It is not coming from the smoking or from smoking also. It is also coming from our day-to-day metabolic activity, and it is coming from inflammatory processes happening in our body. Normal, simple rhinitis and gastritis and urinary tract inflammations, everything will generate free radicals. So free radicals are also contributing for our cell injury. So release of toxic free radicals. So mitochondrial damage can happen through oxidative stress. Oxidative stress means it is a exceeding limit of free radical. Free radicals have a single unpaired electron in the outer orbit. They are highly reactive with adjacent molecules. They are usually derived from oxygen to produce oxygen species. Superoxide, hydroxyl radicals, and H2O2, etc. are the three major free radicals available in the body. So they are normally produced during cellular respiration. So cellular respiration means metabolic activities. So productive molecules include superoxide dismutase, So these are all given in the textbook of pathology. So produced in excess, they react with and damage proteins, lipids, carbohydrates, nucleic acids. So when the free radicals are usually produced even during cellular respiration and metabolic activity, when it is produced in excess, it can damage your proteins, lipids, carbohydrates, even the nucleic acids. So these damaged molecules may themselves be reactive species with a chain reaction being set up with widespread damage. So cell injury is releasing free radicals, and free radicals are damaging these proteins, lipids, and carbohydrates, and these in turn again produce a chain reaction kind of thing, adding more to the problem. So free radicals are characterized by the presence of unpaired electrons. So unpaired electrons seen in the outer orbits are potential enough to produce cell injury. So these molecules can be generated through various endogenous processes such as mitochondrial respiration and in immune cell activation, as well as exogenous sources like radiation, pollution, smoking. While free radicals are essential for certain physiological processes such as cell signaling and immune defense, their overproduction can disrupt the delicate balance between oxidants and antioxidants, leading to oxidative stress. So this is the point I wanted to stress, because free radicals are produced even during physiological process, and these are very important for cell signaling and for immune defense mechanism maintenance. And the overproduction disrupts this balance between the oxidants and the antioxidants, and this is called as oxidative stress. What can disturb this delicate balance between oxidant and antioxidants, we will be seeing in the presentation. So oxidative stress results in the damage of critical biomolecules like DNA, proteins, lipids, contributing to the pathogenesis of various diseases. So these oxidative stress damage the DNA, protein, and lipids, and they contribute to wide range of diseases, the so-called diseases. So if you go and explore about free radicals, you will be surprised to see the vast number of diseases which are produced by the free radicals. But what is the necessity for the body to increase the free radical is a question we will be seeing, will be answering in this presentation. So chronic conditions such as cancer, cardiovascular diseases, neurogenerative disorders, and inflammatory diseases have been strongly associated with the harmful effects of free radicals. So free radicals is important for your cell signaling as well as for your defense mechanism. But once the limit is crossed, or once the overproduction is there, it will be producing all these disease conditions, says the conventional medicine textbooks. So why is it produced in excess is the question of the day. So this review provides a comprehensive overview of the characteristic and type of free radical, their mechanism of formation and biological impacts. Additionally, we explore natural compounds and extracts. So free radicals are produced, and free radicals are essentially produced even during the physiological functioning or during the cellular respiration also, and they are important for cell signaling and immune defense. And when it exceeds the range, it produces wide range of diseases. But now we will stop here and think for a while. Why is hypoxia or ischemia happening in an individual? Why are the free radicals released? Are these the causes of cell injury or byproducts of cell injury? If they are the byproducts, what is the real cause? So we know hypoxia is the main thing, or the main cause or main acquired cause conventional system of medicine attributing for a cell injury. But why is there a reduction in the blood supply or oxygen supply? So if we see means, so there should be something happening even before the disruption of the blood supply to some organ or some tissue, no? So there should be something happening even before the oxygen is getting reduced, no? So what is it? So if something is happening earlier to the disruption of the blood flow, or earlier to the reduction in the oxygen supply. What is it? What is it? So then we cannot say that this is the cause for this, no? So that is what we are going to see today. So we say that the causes given by the conventional system of medicine are not the causes for cell injury, and they are only the byproducts of cell injury. So if this is the byproduct, this is only the byproduct, what is the real cause? We'll be seeing now. So every cell of the organism is endowed with the ability or the inbuilt mechanism to bring back the normalcy. We saw, no, it is called as homeostasis. In GHK or Germanic healing knowledge, we call it as the biological wisdom. So every cell of your body is endowed with this inborn biological wisdom. So we understand that by taking 1 kilogram of sweet, you will not become a diabetic tomorrow morning. So by taking a lots of salt, tomorrow your BP will not raise and you will not be named as an hypertensive. By taking lots of oily food, fatty food, you will not grow fat or you will not become hyperlipidemic or dyslipidemic. So this biological wisdom is constantly working to maintain the functions properly. I will not say that your blood sugar will not raise. Tomorrow or day after tomorrow, it will come back to a normal state. So even if you take 1 kilogram of sweet at a stretch, tomorrow your sugar levels may increase. Day after tomorrow also it may be showing some increase, but it will not stay increased forever and ever like in diabetic patients. So the homeostasis is working constantly to bring it back to the normalcy. That is what the point I wanted to stress here. So I usually give this example to my patients coming to my clinic. If you have a cut in your hand while chopping a vegetable or something, you will not be rushing to hospital. If you have touched a hot vessel and got a blister in your hand, immediately you will not rushing to a surgeon. Why? Because you know the process of healing and you know the duration of healing also. So likewise, if you know the cause and process of healing of every tissue or organ in your body, you will be free from fear of disease and you will have the knowledge which empowers you. You get lots and lots of informations and knowledge in the internet, no? So those informations and knowledge are available on the internet are not empowering you. They are in fact making you more fearful, and every spot on your face or every drop of your hair is threatening you, giving you more information about more grave diseases and more pathological names and these things, investigations to be done and all. So that is not the case with the Germanic healing knowledge. This knowledge empowers you. This knowledge frees you from the fear of disease. This knowledge is gained only by learning German new medicine. That is the reason why it is also called as Germanic healing knowledge or GHK. So we must know what can affect this homeostasis, which has the potentiality to shatter this inbuilt, inborn biological wisdom. So what the conventional system of medicine calls as increase or decrease in BP or sugar or thyroid or TSH or temperature or cholesterol or whatever it is, they are not diseases. They are regulatory mechanisms to adapt and preserve the organism as a whole. This is the reason why the so-called diseases are called as SBS in GHK or GNM. So SBS is an acronym of Significant Biological Special Program. It is significant, it is biological, and it is specialized program for every cell and every tissue in the body, and it has a biological purpose to serve also. Can we explain from conventional medicine point of view, why is this homeostasis failing? Why is this hypoxia happening? Or why is this cell damage happening? Or why the free radicals are released in excess? So what is making the cell to adapt? So this is another thing. So this cell injury, what to say, what is affecting the cell we are seeing, no? So what is making the cell to adapt also? We need to understand why it is happening as hyperplasia, why it is happening as hypertrophy in some people, why it is atrophy in some people. What is the thing that is making the cell to adapt in a hypertrophic way or in an atrophic way? So this cannot be explained from the conventional medicine point of view, and we get it through Germanic healing knowledge. So now you all tell me whether these external factors can cause the so-called diseases, or we have any other predisposing factor which is a precursor for these external causes to influence us. If no, then what can injure the cell and alter the internal environment? So this is the groundbreaking discovery of Dr. Hamer, and to commemorate his birth anniversary, 90th birth anniversary, I have chosen this topic of understanding cell injury and adaptation from the lens of GHK. So precursor for external influence to act upon you is nothing but your own subconscious mind. Your own subconscious mind or the psyche. So cell injury and adaptations are investigated through scans and blood tests. On cellular level or molecular level, it is attributed to hypoxia, ischemia, cell damage, free radical production, free radical overproduction, various physical, chemical, and toxic agents. But why is this hypoxia or cell damage or free radical overproduction happens is missed by the conventional system of medicine. And on top, they say the cause is idiopathic. The modern medicine ignores the mind comfortably and treats man as a machine, repairing and replacing the parts separately. So where and how does the homeostasis fail is best explained by the 5 biological laws of Germanic healing knowledge. So let's explore them one by one. So in GHK or GNM, this injury is defined as DHS or conflict shock. The nature of the conflict shock, as defined by Dr. Hamer, is that it is unexpected, highly acute, isolating, and catches a person off guard. So it is totally unexpected. It happens simultaneously on the psyche, brain, and organ level. Dr. Hamer discovered that this conflict shock is potential enough to cause cell changes, which are nothing but adaptation techniques of the cell to cope up with the conflict shock. He also demonstrated that this technique helps to improve the function of the cell and has a meaning and a biological purpose to serve. And this is the reason why the so-called disease manifestations are addressed as SBS in GHK. The conflict theme is defined by the function of the organ, and the adaptation is to improve the function of the organ so that the organ as well as the individual is in a better position to manage and eventually resolve the conflict. Dr. Hamer also discovered that physical manifestations are tip of the iceberg called SBS. SBS is the complete iceberg. SBS is a significant biological special program, and the physical manifestations, increase in BP or sleeplessness or a rash on your skin, is nothing but only the tip of the iceberg. So two important points to remember in the first biological laws are the we can suffer the conflict on behalf of somebody, and this is called as empathy conflict. And Dr. Hamer says that the dysfunctioning of an organ can result from severe malnutrition, poisoning, or injury without a DHS or conflict shock. So if you remember the acquired causes we saw in the conventional medicine textbooks and all, so we can very well safely eliminate the nutritional defects and the physical agents, chemical agents, ionizing radiations, trauma, injuries and all for the time being for today's discussion, because these do not fall under the category of chronic diseases or internal maladies. So the acquired causes attributed to cell injury by the conventional medicine, except these injury, malnutrition, and poisoning, are all attributed to the conflict shock or the DHS. So nothing is idiopathic. Nothing is idiopathic. They have one more cause, no idiopathic cause. That is not at all possible. There is no smoke without fire. So nothing can happen on your body all of a sudden without any reason or without any purpose. So we have one more cause in the acquired causes, no? So iatrogenic. Iatrogenic is drug induced. Drug induced, they say it is because of the lack of discretion of the physician in selecting the dosage or in selecting the generation of the remedy or something. But what I feel is iatrogenic means drug induced only. But this happens because of lack of knowledge about the disease process. So every remedy or every herbal product or every antibiotic or antihistamine or allergic tablet or whatever you give will not only suppress the physical complaints, will also increase your will also increase your psyche level suffering. Everything which is not addressing your psyche level or your subconscious can be called as iatrogenic from my understanding, because without knowing the disease process or the SBS, only by seeing the tip of the iceberg, that is a physical symptom, you are giving something to disappear the the clear off your skin rashes, or only to decrease your BP, or only to decrease your sugar levels, they may be damaging. Why to say it as maybe? It will be damaging. It will be damaging because you are not addressing your psychic cause. This happens because without understanding the disease progress, if we work on the material level, the increased things will be decreased and the decreased things will be increased. The biological wisdom will act more seriously to show that it is not healed from within. The psyche is still suffering. This is the reason why the dosage is ever increasing in sugar patients, BP patients, thyroid and cholesterol complaint patients. So you are not addressing the psyche level conflict and you are treating only the physical plane, and the body and the inbuilt mechanism that is given to us by the God or the divine thing or universe or whatever you say, or through evolution. So this biological wisdom is constantly trying to bring back the increase thing to normalcy or decrease thing to increase. So without knowing this, if you are giving medicines to decrease the BP or to increase your thyroid levels, means the mechanism which is working inside your body constantly will be working more seriously to show that it is still suffering on the psyche level. So this is the reason I give to my patients also why they would have started with 1 unit of sugar, insulin, and after some due course of 5 to 10 years, they would have landed up in taking 40 units or 20 units in the morning, 20 units in the night and all. So what is happening? So in spite of the medicine you are taking, in spite of the insulin you are taking, the disease is progressing. You have to give this a serious thought. So what we are doing with our body, are we treating the diseases or we are pushing it inside? By ignoring your mind and the psyche, what we are doing to our body. So this has to be seriously given a thought, and this thought-provoking thing is happening only through GHK knowledge. So conventional medicine gives a meager place to psychological stress. You saw in the acquired causes, no? They have given one point as psychological cause also. That too, in case of psychiatric ailments only. But our psyche or the subconscious is the one and only reason for all the internal maladies. So one more thing I wanted to say this with this slide, because I always owe whatever I know or whatever I know today to my guru, Dr. Praful Vijayakar sir. He is a person who introduced this Germanic healing knowledge to all the Indian homeopathy doctors. So he has, expanded the concept of Dr. Hammer for congenital anomalies also. How means it is through this empathy conflict. So if, I told, no, we'll be seeing about the congenital causes further. So in the cell injury, we saw one is the genetic or congenital causes. Second is the acquired causes. So acquired causes only we saw till now. So it is about the congenital cause now. So congenital causes means it is a genetic defect, they say, no? So genetic abnormalities. So even before the genetic abnormality or a DNA change could happen, something is affecting the DNA, no? What is it means? It is the psyche of the mother, which is resonating in sync with the baby inside the womb. So this is the greatest invention or the discovery given by Dr. Praful Vijayakar sir. So he conducts lots of free medical camps and all for congenital for treating congenital anomalies with homeopathic remedies. So sir has given a very vast understanding about this congenital anomalies and causes for the congenital anomalies to happen, and he has treated n number of cases, and his team of followers are conducting still lots and lots of free medical camps for this congenital anomaly cases and all. So we cannot say that it is wrong or it is not, it is totally in the air. So he is able to produce results means it should be true, right? So he has given a concrete evidence and told that the conflicts that is happening to the mother when the child is inside are potential enough to produce these congenital anomalies in the unborn child. So this is the reason for congenital anomalies. I wanted to pay my tributes to my guru and say this in this context here. So we saw in detail about cell injury and also the first biological law. Now we will move on to the second component, that is the cell that is involved or the affected or target cell. So target cell. So the type of cell and its susceptibility, the status, that is a nutritional and metabolic status of the cell, and its adaptability determines how far it can be adapting to the stress or the injury level. Say, for example, skeletal muscles. Skeletal muscles means all your muscles in the body, no? The muscles which are attached to your bones. So skeletal muscles can withstand hypoxic injury for a long time, while cardiac muscle suffers irreversible injury after persistent ischemia due to total coronary occlusion for less than or equal to 20 minutes. So cardiac muscle is also a muscle, skeletal muscle is also a muscle, but skeletal muscle can withstand this hypoxic injury for longer time, whereas your cardiac muscles can withstand this hypoxic injury for just 20 minutes. So it is about the target cell, its susceptibility, its adaptability, and the nutritional and metabolic status of the cell. So can we explain from a conventional medicine point of view why one organ or tissue or system is affected in one individual and not so in another individual? See, if I have to give my example, I have some problem in liver or uterus means the same problem is not happening to my mother. She's also a lady, but she's not having any problem in the uterus. She's having some thyroid problems. So my husband is having some other problem. My daughter is having some other problem. Can we explain from conventional medicine point of view why one person is affected by one organ or one tissue level problem only, why another person is affected by another problem? So this can also be explained from the first law of GNM or GHK. So conflict theme determines the target organ. So we say that the conflict theme determines the target organ. But what determines the conflict theme? So it is highly individualistic and personal in nature, and it is determined by our family upbringing, our life situations, and past experiences, childhood dramas, everything, our moral values, our convictions, our intellectual and level of knowledge, our culture and beliefs, our society, our mode of living, our occupation, our social and domestic relationships, our sensitivities and expectations. All these contribute to, what do you say? What to say? It all contributes to the conflict theme, or how you see a conflict shock. The conflict scenario can be seen by different individual in different ways. I have given this in detail in one of my videos in our website. Interested people may go and watch it also. If a person has died, suddenly, and this has caused a conflict shock to all the family members in the family, one person may be having a liver complaint, and another person may be having a bone and joint complaint, or one person may have suffered a skin disease, or another person may have encountered a what to say, ovary complaint. So death of the person is the same thing, but the conflict theme or the way you see the situation is different for different individuals. And this perception or seeing the conflict scenario determines which organ will be affected. So this cannot be explained by the conventional system of medicine, and this is possible only through Germanic healing knowledge. So third is the cell adaptation. So cell adaptation, as I already told you, cell adapts constantly every now and then. So the adaptation could be hyperplasia, hypertrophy, atrophy, metaplasia, and dysplasia. So cell adapts themselves by undergoing 5 different conditions: hyperplasia, increase in cell size; hypertrophy, increased cell increased cell size is hypertrophy. Hyperplasia is increase in cell number. Sorry, it is mentioned wrongly in the slide. So atrophy, decreased cell size. Metaplasia is conversion of one's adult cell type to another. Dysplasia is disorderly growth. So this is what is represented in this diagram also. So hyperplasia is increased cell number. It is not cell size. So hypertrophy is increased cell size. Atrophy is decrease in cell size. Metaplasia is conversion of one type to another type. Whether this is possible also we'll be seeing now in this presentation. Dysplasia, disorderly growth. So we know that dysplasia is not possible because nothing is disorder in the nature, and everything has a meaning and everything has a purpose also. So atrophy from a conventional medicine point of view, atrophy is a shrinkage in cell size by loss of cellular substances. With the involvement of a sufficient number of cells, an entire organ can become atrophic. Causes of atrophy include decreased workload, pressure, diminished blood supply, or nutrition loss of endocrine stimulation, and aging. So in atrophy, they are giving these causes. So it could be because of the decreased workload, or it could be because of pressure, or it could be because of the diminished blood supply, or it could be because of the nutritional loss or loss of endocrine stimulation, and it could happen because of aging process also. Mechanism of atrophy are not specified, but atrophic cells usually contain increased autophagic vacuoles with persistent residual bodies such as lipofuscin. So we see in case of, I told you, no, so cell injury can be physiological, cell adaptation can be physiological or pathological. So physiological atrophy, as in case of aging process, it may happen. So you see, no, in ladies after menopause, the ovary will undergo atrophy. So this is not a disease condition. So this is a natural process happening. So, but ovarian complaints happening in a female cannot be attributed only to the menopausal age, because every lady will undergo a menopause, or she will attain menopause, but every lady will not have a menopausal disease or menopausal condition. So that is where where we differ from the conventional system point of view. So atrophy can be physiological also. So as in case of the ovarian atrophy happening in menopausal age for every female. So atrophy can be pathological also. So second is the hypertrophy. Hypertrophy is an increase in cell size by gain of cellular substance. With the involvement of a sufficient number of cells, an entire organ can become hypertrophic. So hypertrophy is the increase in the cell number. So cell number increases. So hypertrophy. So hypertrophy can happen as in case of cardiac hypertrophy. With increasing demand, hypertrophy can reach a limit beyond which degenerative changes and organ failure can happen. So there is a increase in the size, as in case of cardiac hypertrophy. You see, no, in your echo report and all. So right ventricular hypertrophy, left ventricular hypertrophy and all. So with increasing need, there could be cell adaptation that is happening to meet the need. So which is really important or needed for the sake of the normal functioning of the body. So cardiac hypertrophy. So hyperplasia constitutes an increase in the number of indigenous cells in an organ or tissue. Pathological hyperplasia is typically the result of excessive endocrine stimulation. So conventional system of medicine says hyperplasia is often a predisposing condition to neoplasia. So we will dismantle this concept also. So I forgot to mention one thing in this slide. So hyperplasia is increase in the cell size, no? So it can happen even during normal physiological conditions like pregnancy and lactation. So pregnant uterus grows in size and number to accommodate the growing fetus, no? So we cannot call it as a disease process. It is a normal physiological process, but the cell is adapting to accommodate the child. So same is applicable for the enlargement of breast and induction of lactation during pregnancy. There is a size as well as the number increase in the breast cell mass to feed the child. So we cannot say that every time the cell adaptation is causing only disease. It can happen even during physiological conditions. So hypertrophy is cell size increase and hyperplasia is cell number increase. Most of the time, both happens together. In some conditions, they may be happening separately also. This depends upon the nature of the cell. So in some cells where the number of cells or proliferation of cells is not possible, hyperplasia will not be taking place. Only hypertrophy will be taking place. As in case of brain hypertrophy, brain cells cannot grow in number. So in such conditions, hypertrophy will be happening. So I told you, know, so for this pregnant or gravid uterus, the hyperplasia as well as hypertrophy will be taking place. So keep this point also in mind. Hyperplasia is often a predisposing condition to neoplasia. Neoplasia is cancer. So we'll be dismantling this also from GHK point of view. So to understand this cell adaptations, pathological hyperplasia, if typically I told you know all those stuff. So GHK dismantles the concept of neoplasia by explaining that The intensity of the conflict determines the growth intensity, and there is no malignancy or benign cell growth in nature. I'm telling you briefly. Now you will understand. So let's try to understand this from second biological law of Germanic healing knowledge. Dr. Hamer discovered that every disease progresses in two phases, provided there is a resolution of the conflict. I always say in my webinars as well as in my presentation, second biological law is my favorite law. This is the first time while reading GHK only, I came to know that disease progresses in two phases. Before that, I was not aware of the healing phase and healing symptoms. Only after reading GHK, I came to know about the healing phase of the disease process. Okay. Conflict active phase also, I came to know only after knowing the GHK. So this is my favorite law, and I have given a very detailed presentation for 2022 Dr. Hamer's birthday celebration, that is World GHK Day. That was the first time we celebrated Dr. Hamer's birthday as World GNM Day or GHK Day. So interested people may go and watch my video on second biological law. So first is the conflict active phase. Only if the conflict is resolved, it will go in for a healing phase. This also you need to keep in mind. So without a conflict resolution, you will not go to the healing process. So as we learned in the homeostasis, there are two equal and opposite factors acting in our body constantly to maintain the vital functions of our body. And these two equal and opposite forces acting on our body can be clubbed together and called as autonomic nervous system. Autonomic nervous system has two equal and opposite forces or system acting upon our body. So it is the sympathetic and the parasympathetic nervous system. So if you see this diagram, you will understand one dilates a pupil and another constricts a pupil. One inhibits salivation secretion, one stimulates a salivation secretion. So when you are not taking food, your salivation secretions should stop. When you are taking the food or on seeing the food itself, your salivation secretions should start. So constantly these two forces are acting in our body to maintain the homeostasis. So normotonia and sympathicotonia and vagotonia are the terms you need to understand while reading the second biological law. Normotonia indicates a balance between the normal day and night rhythm, where sympathicotonia alternates with vagotonia. So what is sympathicotonia is the day mode or the state of stress mode, fight or flight response, which is happening between 4 a.m. to 8 p.m. So vagotonia is the state of stress, state of rest mode, rest and digest mode. So it is a sleep phase. So it happens between the 8 p.m. to 4 a.m. in the next morning. So this is also called as a biological clock or circadian rhythm. So this is severely affected by a conflict shock. So once the psyche is affected by a conflict shock, this normal rhythm is altered. And that is what is given in this picture also. So once the DHS is affecting your psyche, it alters the normotonia state. And only if conflict resolution is happening, it goes in for a healing phase. Same thing I have given in the pictorial representation here. So conflict active phase is also called as cold phase. And only when the conflict is resolved, it goes in for a healing phase, and it is called as warm phase. So conflictolysis is a U-turn. So healing also takes place in two steps. So first is the healing phase, that is the exudation phase. Only if the epileptoid crisis or the brief reactivation of conflict active phase happens, it goes in for a second stage of healing, that is a scarification phase. These are all given in detail in my second biological law presentation. So points to be noted in second biological law are the certain cells undergo cell proliferation during conflict active phase. After conflict is resolved, they go in for cell necrosis, and certain tissues undergo cell necrosis during conflict active phase, and after the conflict is resolved, they undergo cell proliferation. So which organ or tissue undergoes cell proliferation in conflict active phase, and which organ or tissue undergoes necrosis during conflict active phase are all described and given in very, very accurately in German New Medicine. So two more things I wanted to say here. So because we are dealing about the internal maladies, not the trauma or injury or poisoning or malnutrition conditions. So we need to know this. So conflict active phase is the cold phase. So when the conflict is never allowed to resolve, it goes in for hanging conflict. So hanging conflict makes you a permanently patient. So chronic diseases are attributed to hanging conflict when the conflict is not allowed to resolve. So this is I call this as the hazards of master health checkups, because before you get anything on your body or symptoms are coming up on your body, that is healing is happening on the physical level. You are going for investigations after investigations, doing test after test, and you are cutting off the growths, and you are correcting the things you found during your master health checkups. Means you are never allowing your psyche to undergo a conflictolysis, and this will make you in the position called as conflict, hanging conflict. Another state is that hanging healing. So this is the most commonest thing we come across in our clinic. So hanging healing means conflict resolution is happening and bodily healing symptoms are also coming up, but patients will not wait. For them, that is what is called as disease, no? So they keep mismanaging the healing symptoms. They say, I did not do anything, doctor. I applied just a turmeric powder on my abscess. I just used one camphor product on my headache, for my headache. I just taken only one herbal decoction kind of thing only for this cold. Because people are not aware of the fact that only after conflict has resolved, you are getting physical manifestations, and erasing of physical manifestations will make you a permanent patient. So this understanding comes only with the German new medicine knowledge. So after the conflict has resolved, the healing symptoms are happening. Some people take this, what to say, this Dolo 650, no? So paracetamol combinations for fevers and antihistamines and allergic medicines for this cold, running nose and all, no? So these are all nothing but healing symptoms only. Once you do the treatment or home remedies or herbal product management for your physical level problem, you are pushing the problem into the psyche level again, and you are ready to receive the episode again. And this is called as hanging healing in German new medicine. So this is most of the time happening because of the mismanagement of the healing symptoms, and making you a chronic patient. So being in a conflict track also can make you a hanging healing. So tracks is a big topic, and what to say, this epileptic crisis is also a very big topic. And you have one more thing called syndrome. Syndrome, tracks, and epileptic crisis are described in detail in my previous video, second biological law. You may go and watch the video also. So metaplasia. Metaplasia is a reversible change in which, so we lost. So we are seeing, no, so what are all the cell adaptation techniques? In that we have 5 things: hyperplasia, hypertrophy, atrophy, metaplasia, and dysplasia. So now coming on to the metaplasia. Metaplasia is a reversible change in which one adult cell type is replaced by another adult cell type. So metaplasia is a cellular adaptation in which indigenous cells are replaced by cells that are better suited to tolerate a specific abnormal environment. Persistence of signals that result in metaplasia often lead to neoplasia. So like hyperplasia, conventional system of medicine attributes this metaplasia also to be the precursor for your cancers, that is neoplasia. So they are giving examples also. So this concept of one adult cell type converted to another cell type is dismantled by the third biological law. This third biological law is ontogenesis system. So in third biological law, Dr. Hamer explains that I told no, which cell will be undergoing cell necrosis during conflict active phase, which cell will be undergoing cell proliferation in conflict active phase are all very well understood from embryological point of view, and that is what is given in this picture. So endoderm derivatives are controlled from the brain stem. So old and new mesoderm are controlled from the cerebellum and cerebral medulla respectively, and ectoderm derivative organs are controlled from the cerebral cortex. So endoderm, mesoderm, ectoderm. So these are all the three germ layers from which the human organism has developed. So yellow represents endoderm, orange represents mesoderm, red represents ectoderm. So Dr. Hamer has given a concrete law which says that three germ layers are controlled from three different parts of the brain, and they have what to say, like a pattern during the conflict active phase and a different pattern during the healing phase. So all the organs that are derived from endoderm are controlled from the brainstem. Primitive life forms such as bacteria have only endoderm functions. All organs that are derived from old mesoderm are controlled from the cerebellum. So all organs that are derived from new mesoderm are controlled from cerebral medulla. All organs that derived from ectoderm are controlled from the cerebral cortex. So this is called as the compass of German new medicine. So this helps us to understand where do we stand now in the SBS. I told no physical manifestations or only the iceberg of the SBS. We need to understand the entire SBS. Only then you will be in a better position to handle patients. You can give what to say, directions or guidelines to the patients as to what they have to do to work on their own psyche or to work on their own sensitivities and vulnerabilities. So when the patient is coming to you with a clinical finding, you have to understand whether it is a cell proliferation or it is a cell loss, whether it is the whether it is in the conflict active phase or it is in the healing phase. So if he is in the conflict active phase, you have to give techniques or guidelines to resolve the conflict so that he is progressing to the healing phase. So even if he is in the healing phase, you have to give guidelines not to disturb the healing. So what is expected to happen in the healing phase and when not to consult a doctor, or when not to consult a doctor, or when to consult a doctor. All these things you need to be in a better position to educate your client. So this is what is called as compass of GNM. So compass of GNM helps us to understand where do we stand in the SBS. We saw in the acquired causes, no, about the microbial agents and infections and immunological causes. So this is again dismantled by the fourth law of GNM or GHK. So the fourth law says that the microbes do not cause disease. Instead, they play a vital role during the healing phase. Diseases are not contagious. The ontogenetic system of microbes. I told no. So which brain part is controlling which organ, and which organ is undergoing cell proliferation during conflict active phase or say healing phase is all best understood by learning the third and fourth biological law in detail. So Dr. Hamer gives in the fourth biological law that endoderm derivatives undergo healing with the help of mycobacteria, fungi or TB bacteria. So mesoderm derivatives undergo healing with the help of bacteria. Ectoderm derivatives undergo healing with the help of viruses if they exist. So the concept of virus is completely denied by Germanic healing knowledge, and you may explore the resources and references available in the website learninggnm.com. So this is a tabular column. I prepared it myself for easy references. So if you see, Brainstem controlled organs, that is the endoderm derivatives, undergo cell proliferation during conflict active phase, and they undergo cell loss during healing phase if conflict resolution has taken place with the help of mycobacterium. So cerebellum controlled old mesoderm derivatives undergo cell proliferation during conflict active phase, and they undergo cell loss during healing phase with the help of bacteria, especially TB bacteria, if the conflict is resolved. So cerebral medulla controlled new mesoderm derivatives undergo cell loss during conflict active phase. Once the conflict is resolved, they undergo cell proliferation with the help of TB bacteria. So cerebral cortex derived, ectoderm derived tissues which are controlled by the cerebral cortex also undergo cell loss during conflict active phase, and they are substituted, or the cell proliferation happens after the conflict is lysed, and this cell proliferation is assisted with the help of virus, they say. So the fifth biological law is nothing but the quintessence of all the four laws we have seen. Every so-called disease is a part of a significant biological special program of nature created to assist an organism, humans and animals alike, during unexpected distress. So based on sound scientific criteria, Germanic healing knowledge or German new medicine shatters the myths of malignant cancer cells or of malevolent microbes, and identifies infectious diseases as well as cancerous tumors as age-old emergency measures designed to save the organism and not as we have been taught to destroy it. So here I told no. So if the conflict is very intense, and if it is a big conflict or a severe conflict happening for years together, or the patient is in a conflict active phase for a longer duration of time, means the cell proliferation happening during the healing phase also will be proportionate to the intensity of the conflict. So it is it is not very intelligent to classify this much range of cell proliferation as benign, and when it is crossing this limit, it is called as cancer, means this demarcation, no, this is shattered by the understanding of 5 biological laws, because the cell proliferation that is happening is directly proportional to the conflict intensity. If you are in a conflict activity for longer duration of time, you are expected to have violent healing. Whether it is cell loss or it is cell proliferation, it will be proportionate to the intensity of the conflict. That is why in our scripture books and all, or in our religion and all, they are saying no. So resolve the conflict as early as possible. Every night before going to bed, forgive the person who has hurted you, who has conflict, who had conflict with you and all. So as early as possible, if you are able to lice your conflict, the healing phase also will be very brief. If you are sitting in the same sensitivity and vulnerability, and you are in the conflict active all the time, means the proportion of healing also will be proportion of healing as well as the conflict activity also will be equal to the size of your conflict intensity. Okay, so this is what is told here. So now we understand from Germanic healing knowledge law that microorganisms are coming into play during healing phase. So the concept of infectious disease is completely shattered with German new medicine, and the intensity of conflict defines the cell growth. So the concept of benign and malignant from conventional point of view, conventional medicine point of view, is also shattered by the Germanic healing knowledge understanding. So today is the 90th birth anniversary of Dr. Hamer. So I love this quote of Dr. Hamer. If the patient has been made aware of all the facts, he will no longer need to get frightened by his symptoms. He can now fully accept these as the healing symptoms. They are all of which had until now caused fear and panic. In the greatest number of cases, the whole episode will pass without any serious consequences. So in our global GHK Foundation, we make all possible attempts to make this vision of Dr. Hamer, so that we are educating, or we are making the people aware of the facts, so that they are no longer frightened by their symptoms. So the purpose of giving these lectures or conducting these sessions and all, to educate the crowd, so that they are aware of the facts and they are not frightened by their symptoms, and they are in a better position to handle their healing symptoms without complicating or making it a chronic disease. So this is yet another powerful quote of Dr. Hamer. I love this also. I show this in all my presentation. So before I end, I want to tell it again. So to commemorate the 90th birthday of Dr. Hamer. So it says that Dr. Hamer says all so-called diseases have a special biological meaning, while we used to regard Mother Nature as fallible and had the audacity to believe that she constantly made mistakes and caused breakdowns, malignant, senseless, degenerative, cancerous growths, etc. We can now see, that is after learning GNM, we can now see as the scales fall off from our eyes, that is our ignorance and pride that were and are the only foolishness in our cosmos. Blinded, we brought upon ourselves this senseless, soulless, and brutal medicine, full of wonders. We can now understand for the first time that nature is orderly, and that every occurrence in nature is meaningful, even in the framework of the whole. Nothing in nature is meaningless, malignant, or diseased. Everything has a purpose. So with this, I end my presentation. Thank you, one and all. So the reference sources available in the internet, authentic sources available in the internet, or www.globalgnm.com, our own website, where you have lots and lots of free materials available. So you can refer those audio lectures by Dr. C.J. Varghese sir and presentations by various speakers, including myself. So in our website, www.globalgnm.com. So you have the habit of reading and you can read and understand things, means you can go and read the website www.learninggnm.com. This is another authentic website from the direct disciple of Dr. Hamer. Miss Caroline Marcolin, madam. So this is a very authentic website. So you may all go and read if you want to learn GNM in depth and take control of your health and take control of your loud and near and loud ones' health also. Thank you. Thank you, everybody.